Welcome to NURS 245 Nursing Practical 4. In this session, we are going to look at transfers of patients from a ward or from the hospital to another hospital, and then from a ward to a different ward, that is Transin. My name is Mrs. Cecilia Eliason, a lecturer at the School of Nursing. In this session, you need to complete the needed documentation after transfer according to the hospital policies. Transfer of a patient is shifting a patient from one department to another department in the same hospital or between hospitals. There are two types of transfers, Transin and Transout. The key topics to be covered under these sessions are introduction to transfers, Transin, Transout, and then abscondees. So under topic 1, we'll look at introduction to transfers. Transfer, this is complete the needed documentation after transfer according to hospital policies. Transfer of a patient is shifting a patient from one department to another department in the same hospital or between hospitals. There are two types of transfers, Transin and Transout. The purpose for transfers is 1, to receive different forms of therapy management. 2, to provide for more skilled care and close observation in specialized units. 3, to have care continue closer home. And 4, when financial resources prohibit receiving care in the current facility. The requirement for transfers: an ambulance, wheelchair or a stretcher, oxygen tank and tubing, drip stand, cardiac monitor, requisition forms, referral forms and notes, records of clients, make appropriate bed, for example, cardiac bed. The steps for transfer: assess reason for patient's transfer in collaboration with the physician. Inform charge nurse of new ward about the transfer. Check client belongings. Keep all records up to date. Complete patient charts and make it up to date. Assess patient physical condition and determine mode of transfer. Explain and let client understand the reasons for transfer. Confirm client for the transfer. Inform client and relatives about the transfer. Anticipate problem that patient may develop and intervene, for example, nebulization. Assist to transfer patient to stretcher. Check on vital signs, airway, etc. Accompany patient to the receiving unit. Hand over all documents and property to the receiving net and ensure all items are noted. So we move on to Transin. This is when a patient moved from the unit or a place of first admission to a new area, mostly specialty areas for update treatments. This could be on unit basis or department to department in the same hospital. For example, from medical to surgical or hospital to hospital basis. Example, general to psychiatry hospital. This is usually pre-arranged and the receiving ward or hospital must be informed of incoming patient general condition. The steps for Transin: make appropriate bed to receive patients. Assemble necessary equipment, oxygen cylinders, suction machine, etc. Assemble documentation and investigation forms. Make all admission forms and books ready. Receive incoming patients, relatives, and accompanying nurse and reassure them. Take over transfer notes and personal belongings from the accompanying nurse. Confirm identity of patient with accompanying nurse. Ask for the clarification on vital issues pertaining to patient's condition from accompanying nurse. Introduce self to patient and relatives and reassure. Do a quick assessment of patient condition and needs and act accordingly. Admit patient using nursing care plan. Orientate patient condition and route of unit if necessary. Document time and arrival of patient in nurse's notes, admission and discharge book, and onto the ward bed state. Transout. Transout is when a patient is removed from a unit or a place of admission to a new place for update treatment. This could be done at the discretion of medical team or at patient's own request. This could be on one unit-to-unit basis, medical to surgical, from one hospital to another, normally to a specialized area. A good knowledge of a patient condition is very important. Requirement for Transout: 24-hour report book, the changes book, admission and discharge book, ward state, client folder, nurse's note, client drugs trolley with the following items: a plastic bowl or a bucket with the contaminants, utility gloves, a duster, a linen receptacle, or a bin. The steps for Transout: confirm with receiving unit, assess patient condition, arrange for accompanying nurse, arrange for appropriate vehicle where applicable, collect all necessary data, explain reason for transfer to patient and relatives, help client to pack his medication, X-ray films, and transfer notes. Let patient settle bill where applicable. Assist patient to dress up. Assist patient onto stretcher, wheelchair, ambulance where applicable. Hand over patient's name in appropriate, for example, admission and discharge book, nurse's book, ward state, and bed state. For our final topic under this session, abscondees. This is where a patient leaves the ward or hospital unceremoniously or without authority from the medical team and without paying the hospital bill. Clients are at times abscond from the hospital or the healthcare facility because of the following: 1. Have another form of treatment, for example, a prayer camp or a fetish priest. Have no money to pay hospital bills. Psychological problems, for example, dementia. Steps: inform the authorities or the nurse in charge immediately. Inform the doctor, the hospital security officer, the hospital welfare officer. Provide the above with appropriate information, for example, name of the patient, the age, the sex of the patient, medical diagnosis, and the residential address of the patient. Document patient's absence in all necessary documents and forms, for example, in the nurse's notes, the ward or bed state, admission and discharge book, and in the report book. Inform nurse of kin, telephone call or house address. Police should be informed through the hospital administration. In summary, we have looked at transfers, look at the various types of transfers, Transin and Transout, and also look at abscondees. For your references, you have latte on tips on practical nursing procedures, Nicole, Bavin, Cronin, and Anderson, Essential Skills Handbook for Nurses and Midwives, and then Standard Procedure Manual for Nurses in Ghana. Thank you.